Welcome back, dear viewers. In today's video, we are going to discuss about the one of your important essay question which is quite frequently asked. So that is the breast or the mammary gland, otherwise which is called as the mammary gland. So today's session will go like this. We are going to discuss the location and what is the type of the gland. We are going to discuss what is exactly the mammary bed. We're going to see what is the retromammary space and what is this axillary tail of Spence, what is the symmetry, and we'll be discussing the features and the structure of the mammary gland, and of course we will be discussing about the blood supply, nerve supply and lymphatic drainage of the breast and the applied aspects as well. So let's go into the session. We'll discuss the location and type first. So where exactly is this mammary gland located? So this is located in the superficial fascia of the pectoral region. It is located in the superficial fascia of pectoral region. Okay. And what is the type of gland? What do you think is the type of gland? This mammary gland is a modified sweat gland. It is a modified sweat gland. So this can be like one of your MCQ. So the mammary gland is present in the superficial fascia of the pectoral region and it is a modified sweat gland. It is present in both the sexes, male and female. Now, what is this mammary bed? So in anatomy, whenever we say bed, it is the list of structures on which the particular organ or that particular structure rests. Okay. So those muscles are referred to as the mammary bed. All the muscles on which this mammary gland will rest is what we are referring to as the mammary bed. So what will make up the mammary bed? So even before going into the mammary bed, I would like to tell you about the extent of this mammary gland. As I told you, it is present in the superficial fascia of the pectoral region. So its extent. So the vertical extent, this is the vertical extent. Vertical extent, this is the horizontal extent. Vertical extent is from second rib to sixth rib. Okay. And the horizontal extent is from the lateral border of sternum, to the mid-axillary line. So what did I tell you? The vertical extent of the mammary gland is from the second rib to sixth rib, and the horizontal extent is from the lateral border of sternum to the mid-axillary line. So that is the extent of the mammary gland. So now what are the structures on which this mammary gland rests, which we are referring to as the mammary bed? So in the medial 2/3 part, so up to this level, the medial 2/3 part rests on pectoralis major muscle. So this is the pectoralis major. Okay. And the lateral 1/3 part will rest on the serratus anterior muscle. This is the serratus anterior muscle. And the infromedial part, the small infromedial part, it is resting on the aponeurosis of external oblique. So what are the structures which are making up the mammary bed? One is the pectoralis major in the medial 2/3 part and serratus anterior muscle in the lateral 1/3 part, and in the infromedial part it is resting on the aponeurosis of external oblique. So these three are the structures which are making up the mammary bed. So we have discussed about the mammary bed. Next, moving on. Retromammary space. Now what is this retromammary space? As I told you, this mammary gland is resting on some muscles which we call them as mammary bed. Now you see the lateral view, of the. So in a section, this is the pectoralis major muscle. So this muscle is covered by deep fascia, and on that you can see the location of the mammary gland. So in between the pectoralis major muscle covered by its deep fascia and the mammary gland, you can make up some small space which is filled with loose connective tissue, loose areolar tissue. So this is what we are calling as retromammary space. So the space which is present between the mammary bed structures and the mammary gland is what we are calling as retromammary space. So because of the presence of this retromammary space, the mammary gland is freely mobile over the underlying muscles. Okay, so that is about the retromammary space. Now what is this axillary tail of Spence? So the mammary gland which is there is almost cylindrical, and you see a tail-like projection from its upper and outer quadrant, upper lateral quadrant. So this will pass through a small opening which is present in the axillary fascia. So that is called as foramen of Langer. Okay, so it will pass through a small opening which is called as foramen of Langer, and it extends almost up to the anterior group of lymph nodes. Okay, anterior axillary lymph nodes. It will reach up to the anterior group. So sometimes the carcinoma of this axillary tail of Spence can be misdiagnosed as a lymph node enlargement. So that is the clinical importance of this axillary tail of Spence. So that is about the axillary tail of Spence. Next, coming to the symmetry. It is bilaterally symmetrical in most of the cases, but in few subjects, the right side mammary gland is bit larger than the left side. So that is also considered normal. Next, coming to the features over the skin and its structure. So coming to the features over the skin. What do we see? Over the skin, we are able to make out two important structures. One is the nipple and the other one is the areola. So this is the nipple, and surrounding that you have got a pigmented region which is called as areola. So nipple is a cylindrical projection which is present in the fourth intercostal space, and this is pierced by the lactiferous ducts. You see, these are all the ducts. These are the lactiferous ducts. It is pierced by about 15 to 20 lactiferous ducts, and it has got smooth muscle which is arranged in a cylindrical and a longitudinal fashion, and this has got a rich nerve supply for the suckling reflex in during lactation, which is important during lactation. So features of the nipple. It is pierced by 15 to 20 lactiferous ducts. It has got smooth muscle which is arranged in circular and longitudinal fashion, and it has got a rich nerve supply. It is highly sensitive. Next, coming to the areola. The pigmented part, the darkly pigmented part which surrounds the nipple is what we are calling as the areola. It is the darkly pigmented part surrounding the nipple. Okay, so this areola, it has got number of sebaceous glands. So these secretions from these sebaceous glands are important in order to provide lubrication during lactation. Okay, and these sebaceous glands, they are enlarged during pregnancy. So that condition where these glands are enlarged during pregnancy, they are called as Montgomery tubercles or tubercles of Montgomery. Okay. So the enlarged sebaceous glands during pregnancy which are present in the areola, those are referred to as Montgomery tubercles. Okay. So that is the features you see in the skin of the mammary gland. Next, moving on to the structure. So the structure of this mammary gland, it is made up of 3 different components. So the mammary gland, it is made up of 3 different components. One is the, the glandular part. The other one is the fibrous part. And third one is the fatty component. Okay. So the 3 components, the glandular part, and we have got the fibrous part, that is the fibrous tissue, and you have got the fibro-fatty component, interlobular fatty tissue. Okay. So these are the 3 different parts. So we'll write it down. Interlobular fatty tissue. Okay. To be more specific. Next, we will discuss each one. The glandular part. So, you have a look at this diagram. So, this one is showing the glandular part. The glandular part, it is made up of tubulo-alveolar glands. Tubulo-alveolar glands. Okay. So, the mammary gland as a whole, it is divided radially into lobes. Like this, it is divided into lobes. 15 to 20 lobes. Radially arranged 15 to 20 lobes. And in each lobe, you have got one lactiferous duct. So that is why I told you the nipple is pierced by 15 to 20 lactiferous ducts. So the ducts and the alveoli will make up this glandular part. So they are made up of tubulo-alveolar glands. So you see, this is the lactiferous duct. Before opening into the nipple, it is showing one small dilatation which is called as lactiferous sinus. Lactiferous sinus. Okay. And then this will continue as the segmental duct. This segmental duct will further subdivide into terminal ducts. Terminal ducts. And these terminal ducts, they enter into the alveoli. That is the secretory part, the glandular part. These are the alveoli. Okay. So each part which is being supplied one by one terminal duct is what we are calling as lobule. Lobule. Okay. So each lobe has got many lobules. Part of the mammary gland which is being drained by one terminal duct. Terminal duct is what we are calling as lobule. Okay. So in the mammary gland there are 15 to 20 lobes which are, each one is drained by one lactiferous duct, and the part of each lobe is again further subdivided into lobules. That is part of the mammary gland which is being drained by this terminal duct is called as one lobule. So this is one lobule, this is one lobule, like that. And okay. So that is about the glandular structure. Glandular structure. Next, we will have a look at the second one. What is the second one? It is the fibrous septa. Second one is the fibrous septa. So now let's discuss about the second segment, that is the fibrous septa. So these fibrous septa, they actually help to hold the, give support to the parenchyma of the mammary gland. So they connect the parenchyma with the underlying muscle and with the overlying skin, thus providing support to the mammary gland. So these fibrous septa which are extending from the parenchyma of the mammary gland to the skin and to the underlying muscle, those are called as ligaments of Cooper. Ligaments of Cooper. So these are the ligaments of Cooper. So if these ligaments of Cooper, they are being affected by the carcinomatous cells, that is the cancer cells in CA breast, what will happen is it will cause the shrinkage, it will cause the retraction of the skin, and it will give rise to the dimpling and puckering of the skin. Dimpling and puckering of the skin. We'll discuss this part in the applied aspects. So that is about the ligaments of Cooper. Next, in between the parenchyma, you have got the interlobular fatty tissue. So what is the exact function of this interlobular fatty tissue? It is nothing but the adipose tissue which fills the gap in between the lobules, and the main function is to maintain the contour or shape of the mammary gland. That is because of this interlobular fatty tissue. So this is about the structure of the mammary gland. So what we have seen? We have seen there are three components: glandular component, we have seen the fibrous component, and we have seen the interlobular fatty tissue. Glandular component is the tubuloalveolar glands, and fibrous component is this ligaments of Cooper, and fatty tissue is the adipose tissue, which is fat tissue which is present in between the lobules. And you see the mammary gland, it is divisible into 15 to 20 lobes which are radially arranged from the center. And each lobe, it is drained by one single lactiferous duct. And each lobe, again, it is divisible into lobules. Lobules are nothing but that part of the mammary gland which is being drained by the terminal duct. Okay, so that is the structure of the mammary gland. Now moving on, we will discuss about the blood supply of the mammary gland. Blood supply means arterial supply as well as the venous drainage. So this is the arterial supply of the mammary gland. So this is the medial part and this is the lateral part. So the main blood supply of this mammary gland is through branches of axillary artery and through branches of internal thoracic artery and the intercostal arteries, posterior intercostal arteries. Okay. So this is the axillary artery which is divided by the pectoralis minor into first part, second part and third part, and the branch of the first part of axillary artery is the superior thoracic artery, and the branch of the second part is lateral thoracic artery. Okay. Now this mammary gland, the upper part of the mammary gland is being supplied by the superior thoracic artery, which is a branch of the first part of axillary artery. The lateral part of the gland is being supplied by the branches of lateral thoracic artery. So the branches given off by the lateral thoracic artery are referred to as lateral mammary branches. Okay. And the medial part of the gland is being supplied by branches of internal thoracic artery. So which branches of internal thoracic artery? Perforating branches of second, third and fourth perforating branches of the internal thoracic artery will form the medial mammary branches which will supply the medial part of the gland. Now what about the under surface of the gland, the deeper surface? That is being supplied by the intercostal arteries, the second, third and fourth intercostal arteries, posterior intercostal arteries. So that is the arterial supply. This is one of the important question again. Okay, I repeat, the upper quadrant is being supplied by the superior thoracic artery, lateral part of the gland is being supplied by the lateral thoracic artery, medial part of the gland is being supplied by the perforating branches of internal thoracic artery, and the deeper surface of the gland is being supplied by the branches of the intercostal arteries, posterior intercostal arteries. So that is about the arterial supply. Next, let us have a look at the venous drainage. So the veins will always accompany the arteries and they will have the same name as that of the arteries. So the venous drainage from the mammary gland, they will form a plexus in the areolar region, which is called as circulus venosus. Okay. So all the venous blood is first collected through the circulus venosus from the gland, and from there it will drain into the axillary vein. It will drain into the lateral thoracic vein, and it will drain into the internal mammary vein, and they will drain into the posterior intercostal veins. So drainage into this posterior intercostal veins is clinically important. Why? Because after the blood from the mammary gland is draining into this posterior intercostal veins, through the azygous vein, through the azygous system of veins, it will communicate with the internal vertebral plexus. That is the plexus which is present within the vertebral body. Internal vertebral plexus. So through this, it will again communicate with the intracranial sinuses. So that means, why is this important is, any carcinoma from the mammary gland can spread to the vertebrae and it can spread to the brain as well. So that is how the carcinoma spreads throughout the body. Okay. So that is why this internal vertebral plexus, it is also referred to as Batson's plexus. So this is clinically important. Okay. So the venous drainage into the axillary vein, lateral thoracic vein, internal mammary vein and posterior intercostal veins. So that is about the venous drainage of the mammary gland. Now that we have seen the blood supply, we will see the nerve supply. Nerve supply of this mammary gland is by the anterior and lateral cutaneous branches of 4th to 6th intercostal nerves. I repeat, anterior and lateral cutaneous branches of 4th to 6th intercostal nerves. Next, we will have a look at the lymphatic drainage. So, lymphatic drainage of the mammary gland, it is divisible into two aspects. One, which drains the parenchyma, including the nipple and areola. Okay. And one which drains the overlying skin, excluding the nipple and areola. So we are not including nipple and areola here. So in the parenchyma with nipple and areola, what is the lymphatic drainage? So lymphatics drainage of the parenchyma with the nipple and areola, we are going to discuss now. So the lymphatics, the subdermal lymphatics, they will form a plexus in the areola, subareolar region. It is called as lymphatic plexus of Sappi. Subareolar lymphatic plexus of Sappi. Okay. From here, 75% of the total mammary gland will drain into the axillary group of lymph nodes. Which group? Anterior group and apical group. So these are again parts of the axillary group of lymph nodes. So if you want to know about the axillary lymph nodes in detail, please refer to my video on axillary lymph nodes. Okay. So 75% of the parenchyma of the mammary gland will drain into the anterior group and apical group of axillary lymph nodes. Remaining 20% from the medial part of the gland. Medial part of the gland will drain into parasternal group of lymph nodes. Parasternal, present on either side of the sternum. So we are calling them as parasternal group of lymph nodes. Remaining 5% will drain into the posterior intercostal group of lymph nodes. So this is the lymphatic drainage of the parenchyma. Okay. So 75% into the axillary group, 20% into parasternal group. Parasternal group is otherwise also called as internal mammary group, and 5% from the posterior aspect into the posterior intercostal lymph nodes. Now we'll have a look at the lymphatic drainage of the skin, excluding the nipple and areola. Okay. So here we have divided the mammary gland into quadrants, into a superior quadrant, and the remaining part is divided into medial and lateral quadrants. Okay. From the superior quadrant, the lymph, it is draining into the infraclavicular and supraclavicular group of lymph nodes. Okay, so these are the present below the clavicle, above the clavicle. Okay, so from the superior quadrant, the lymph is being drained by the infraclavicular and supraclavicular group of lymph nodes. The lymph from this infraclavicular group of lymph nodes, after piercing the clavipectoral fascia, it will finally drain into the apical axillary lymph nodes, apical group of axillary lymph nodes. Next, we have divided the remaining into a lateral half and a medial half. This is the lateral and this is the medial, because this is the sternum. Okay. So from the lateral half, they are draining into the axillary group of lymph nodes. These are the axillary group of lymph nodes. From the medial half, they are draining into the parasternal group of lymph nodes, which are otherwise called as internal mammary group of lymph nodes. So there is one specialty for this parasternal group. You see, they are freely communicating with each other across the midline. So the lymph from this side of the mammary gland and this side of the mammary gland, the lymphatics, they are intercommunicating with each other. So why is it important? If one mammary gland is affected with carcinoma, that is cancer, that can spread to the other side mammary gland as well through this intercommunicating lymphatic channels. Okay, so that is about the parasternal group of lymph nodes. Next, the infromedial quadrant of the mammary gland. See this part. Okay, so if we take this part, a part of it will pierce the rectus sheath. Few lymphatics, they will pierce the rectus sheath and they will enter the subperitoneal plexus. And from there, through the falciform ligament, they will reach the hepatic nodes of the liver. So in case the carcinoma cells, that is the cancer cells, if they spread this way and they reach these hepatic nodes and they cause enlargement of this hepatic nodes, that can lead to a obstructive jaundice. Sometimes what happens is, the cancer cells, while passing this way, they drop into the peritoneal cavity. And they will reach the ovaries, where they form secondary deposits. Those are called as Krukenberg's tumor. Okay, so when the cancer cells, they drop into the peritoneal cavity and they form secondary deposits in the ovary, we refer to them as Krukenberg's tumor. Okay, so that is the applied importance of this lymphatic drainage. Mammary gland is a essay question, and lymphatic drainage of mammary gland is also one of the important question which is quite frequently asked because of its clinical importance. So this is what you're supposed to understand. Next, with this we will have a look at the applied aspects. So applied aspects in relation to this lymphatics, as I told you, one is the Krukenberg's tumor, okay, and when they affect the liver, it will cause obstructive jaundice, and the carcinoma cells from one side can spread to the other side. And while mentioning the venous drainage, I told you carcinoma cells can spread to the vertebrae and they can spread to the brain as well because of the communication with the internal vertebral venous plexus, which we call them as Batson's plexus. When the ligaments of Cooper are involved, they are traversed by these cancer cells. They cause puckering of the skin, So these are all the applied aspects in relation to the mammary gland. Thank you for watching.